Hello, my name is Dr. Alan Spiegel. I'm a neurologist practicing in Florida for the past 35 years and practicing hyperbaric medicine for the past 20 years. In our office, we use hyperbaric medicine to treat many different diagnoses, of which long hauler syndrome or post-COVID infection is one of them. 10% of those who have been treated with inoculations for COVID, as well as those who unfortunately have had the COVID infection, have developed post-COVID symptomology. These include brain fog, inability to multitask, memory loss, difficulty with concentration, fatigue, mental stress, anxiety, depression, all of which impedes your ability to return to work. In addition, these people complain of body aches, joint pain, headaches, as well as loss of sense of smell and taste. These can be detrimental to the ability of people to function to the level that they were prior to this infection. The reason why hyperbaric oxygen therapy works phenomenally well for COVID infections is the fact that the COVID bug attacks the red blood cells, which carries oxygen, thus depriving every tissue in the body of adequate oxygenation, causing damage to each of those tissues. Hyperbaric oxygen therapy does not require the use of hemoglobin. It goes beyond the hemoglobin, goes into the serum, goes into every cell in the body. Therefore, you do not need the hemoglobin to get to all the tissues in the body, and that's why it causes decreased swelling, decreased inflammation of the lungs and the body tissues. It improves the immune system to fight off the COVID infection. Your immune system's been devastated by this rampant infection that's going on throughout the entire body, and hyperbaric therapy improves the immune system where it is not getting adequate help. Therefore, it makes sense that when you're trying to treat COVID infection, now treating post-COVID, you're improving the function of your immune system and the reduction in inflammation by the same means. Makes perfect sense why it should help you. And we have been successful in most people we've treated with this disorder, and you have to consider this as an option for treating the symptoms you're having and not have to learn to live with them. We've seen people who've been for a whole year unable to return to work because of cognitive impairment, joint pains. I've seen athletes who've come to my office who used to run 5 miles every day, 10 miles every day, who can't even get out of bed and walk to the kitchen. With hyperbaric therapy, in a short period of time, they were able to return to the activities they used to perform. They were able to go back to work, improve their livelihood once again, and return to their family life. This is what you really want. This is why hyperbaric therapy has to be a consideration among all the other things you've done to get better. The one takeaway I want you to have from this video is there is hope in getting over the long hauler syndrome. Let me just give you an example of where hyperbaric therapy was used in LSU, Louisiana State University. There were 11 people in their ICU, 6 of which were getting ready to be put on a ventilator, 5 not far behind those 6. Each of them were treated with 1 session of hyperbaric therapy for 5 days in a row. Every one of those patients went home early. None of them needed a ventilator. All responded phenomenally well, and only because of the hyperbaric therapy. There were autopsies performed on some of the unfortunate people who did not survive the COVID infection. And they have found that these patients have a multitude of small blood clots through the brain, liver, and kidneys, as well as lungs. These blood clots have caused decreased blood perfusion to each of those different organs. Now we're talking about the brain. Little blood clots in the brain are like little mini strokes. If you can improve the circulation to the brain, reduce the inflammation commonly associated with small strokes, you can improve the function of the brain, thus reducing many of the symptoms that are brought out by the COVID infection. We have treated many patients in our office with post-COVID symptomology, or what they call long hauler syndrome. We have not had any patient that was treated in this modality with both hyperbaric therapy, some IV infusions we found very efficacious, and then beamer therapy. Together, these three products have improved the outcome of every one of our patients we have treated. So if you have some problems that have not resolved with post-COVID symptoms, give us a call, because we have the ability to reduce your symptoms and get you back to the life you had before.